Good morning. My name is Kevin Hejtmanek, and I'm a physical therapist at Stewart Memorial Hospital in Lake City, Iowa. And I'm here today to talk to you about a new treatment that we're providing here at SMCH called dry needling. I myself have been doing dry needling for about a year, just over a year. I was certified in February of 2017 and been treating in the Des Moines area, now coming to Lake City. I have with me today two other therapists who have most recently been certified, and I'll let them introduce themselves.
I'm Branden Roberts, and I am a physical therapist here, and Luke and I are most recently certified in February of this year.
Yeah, my name is Luke Larson, also another physical therapist here. Like Branden said, we've been dry needling for a few months now, and I've been working here almost 2 years.
All right. What we'd like to do for you today is demonstrate how dry needling works, and Branden has agreed to be our patient. So while he gets set up, I'm just going to talk to you a little bit more about dry needling. So dry needling is a technique where we release trigger points in the muscle belly. We do have other techniques that we've used in the past to help get those trigger points out, but dry needling is a little more invasive and efficient. What a trigger point is it's an area of the muscle spindles that have just got a lot of junk in them, and they're not getting good blood flow, they're not getting good oxygen. So what we want to do is utilize the needle, go into the muscle belly, and contact that trigger point. When we get that, we get a spontaneous response called a twitch response. That says we've hit the spot and the bad stuff has got out of the muscle and good blood flow and good oxygen is starting to go through that muscle, which is needed for good muscle function. So usually when we go into the muscle, we try to bypass the pain barrier. The needles are very small in gauge, so we're not injecting anything or doing anything of that nature. So Branden is all set. We're going to head over and do a demonstration. So as Branden's all set, we're going to work on his shoulder. What I'm going to do is get some gloves here. All of our needles are sterile. We use them only on one patient, and we discard them after each use. Sometimes they can be used one, maybe 2 times, but I never go more than 2, just for sedentary purposes. So here, a little alcohol here just to kind of wipe the area clean here. We're going to go to Branden's upper trap today. Get that clean. As I take the needle out, set it down there. What I like to do is I go ahead and I grab a hold of the muscle. Being it's his upper trap, it is a bigger muscle. I usually treat bigger muscles to smaller. But now I know everything I'm needling is just in my hand to help take it away from other areas of the body, such as the lungs, etc. We have different size needles for different areas of the body that we're going to do. Now, as I mentioned before, we're looking for what's called a twitch response. In these bigger muscles, sometimes you can see them. I can usually feel them, or the patient will say, I felt a twitch. In my experience, that's the time it can be a little discomforting. So I ask the patient, let me know how you're feeling, what you felt. If they need me to slow down or take a break, we can do that. If they want me to stop, obviously we stop. So I'm going to have Branden roll a little bit more there. I'm going to find a nice little spot right there. So we're just going to take this here and tap the needle in. So the needle's in, and we're just going to start searching around the area for that trigger point we palpated. And there we had a little twitch. This is called a pisting technique. It's going right around the area. Branden, how you doing?
Good.
Doing pretty good. Most often there was a little twitch there. Doing okay with that?
Mm-hmm.
Usually 30 seconds to a minute is about the only time I'm really in. And there's a good one there. We're just going to clear that area out. And we're going to take the needle out. Provide a little bit of pressure to the area. With the gauge of the needle being very small, there's really no bleeding involved. All that's done. Okay. I'm going to walk over to dispose of my needle real quick. And that is it. After treatment, again, we like to probably stretch the muscle out since we've kind of started to get good blood flow and good oxygen going through that muscle. We like to stretch it out. This is just one part of the treatment. What we try to do is use this as comprehensive treatment. So, not only are we doing dry needling and focusing on that trigger point, but also what may have caused it. So we incorporate this into stretching, strengthening, posture is a big one, activities. And we want to try to help correct those imbalances that may be causing these trigger points. So if you have any questions or would like more information or look at dry needling, please contact your provider and we'd be happy to help you. Thank you.